I'm so glad to be here. I'm MK, Executive Director of Those Nerdy Girls, and we're going to be talking with Dr. Kat Cartwright today about PCOS and the new changes that have happened. Dr. Cartwright, thank you so much for being here. Do you want to say a little bit about yourself?
Sure. I am an OBGYN fully in clinical practice and dealing with things like PCOS or PMOS every single day. So this is something that we're already seeing and hearing a lot about on the clinical side of health and medicine that I'm happy to talk about today.
Amazing. So let's just start. What has changed with what we used to call PCOS?
So PCOS is the acronym for Polycystic Ovarian Syndrome, which probably 10 times a week I say to someone that if I could rename anything in medicine, I would rename PCOS because it has nothing to do with cysts and it has to do with your ovaries, but they are really not the problem. So we have now, literally the global medicine community has renamed PCOS to PMOS, which now stands for Polyendocrine Metabolic Ovarian Syndrome. And that is a mouthful, but what we have pulled into the name is the other systems that actually cause a lot of the issues of PCOS or PMOS, and we have really broadened the parts of the body and the systems in the body that are affected by this syndrome. 1 in 8 women are affected by PMOS, and that equates to over 100 million people globally that are impacted by this. Better explanation of exactly what it is and better naming of the systems that are affected is going to significantly help in the diagnosis and the treatment for them.
I do want you to speak a little bit more about how this will improve diagnosis and care of the people affected.
Sure. So one of the things that people most often walk in the door with when they have PCOS or PMOS is irregular periods or issues with the reproductive system. And so the name of this syndrome plus the symptoms that are the most often first presenting lead to them being really pushed into the gynecologic sphere. And a gynecologist does a really good job typically of helping to manage irregular periods, fertility issues, and some of the symptoms from a PCOS standpoint there. But we know that this is a much broader metabolic disorder where we really see changes in insulin, we see changes in skin and dermatologic issues, we see huge metabolic changes, which really means that they have changes in cholesterol, higher risks of type 2 diabetes, insulin resistance that can have a huge impact on things like weight and other longer term concerns for people. And that often gets missed when this is pushed right into the gynecologist's office.
Okay, so it sounds like more people are going to be able to get diagnoses earlier and help for PMOS earlier than previously.
Exactly. So as a gynecologist, what I often say is, we know this has metabolic impacts. You're at an increased risk of type 2 diabetes in your lifetime, but I'm also not really equipped to help adequately manage that as an expert in reproductive organs. And earlier diagnosis from other specialties, whether it's primary care specialties, endocrinology, even dermatology, if they're seeing people who meet these criteria really involving themselves and having a multi-specialty management and diagnosis is going to get people into care for this a lot sooner.
Could you just spend one moment talking about the criteria so that our listeners, if they hear a friend, they have symptoms themselves, or they hear a friend or a loved one, they can point them in the right direction?
Yeah, so PMOS is diagnosed if someone meets certain criteria. It's a syndrome, which means it presents differently in different people. So we use potential criteria to diagnose this. There are really 3 things that we specifically look at. And if someone has 2 or more of those, they have PCOS, PMOS. And those 3 things are irregular periods. So irregular periods could be missed periods, skipped periods, multiple periods in a month, but they really indicate that you're not ovulating regularly. So irregular periods is 1. The second is increased androgens, which often is testosterone as an androgen. And that could be on blood work or it could be symptoms that people have. Excess hair growth, acne, those are the types of symptoms we see. And then we also can do blood testing for this. The third criteria is what we call polycystic appearing ovaries. They don't actually have big cysts on them, which is really where some of this name change comes from. What they have are very small eggs or follicles on the ovary because someone's not ovulating regularly. That's a visual feature of the ovary that we can see. So if someone has 2 of those 3 things, then they meet criteria and they have PMOS, previously known as PCOS.
That's wonderful. Dr. Cartwright, thank you so much for coming in today and helping us understand this name change.